I hope that my presentation today can be a little bit of hope and positivity and empowerment against something that a lot of people are suffering through. We're going to talk about the guidelines, the exercise and physical activity guidelines for liver health, the types of exercise, how much you can do. But beyond that today, I hope to provide not only anyone who is dealing with this or caretaking with this, but anyone, a human with a beating heart, on how you can effectively make some lifestyle changes. Because in my experience as an exercise physiologist, I can tell you for hours and hours, hey, you should exercise. But unless we actually talk about what is keeping you from making those changes, we're not really likely to see a bit of difference there. So that's my hope for today. There's lots of opportunities today to take pictures of my slides. I have lots of resources there, so I welcome questions, and feel free to take out your phone and snap pictures of things if that would be helpful for you. I want to start off with a question that is not a joke and not facetious, but I'd like to just survey everyone here today. Could you just raise your hand if you think that exercise might be good for you, generally speaking? Yeah, like every hand in the room goes up, right? It's a little bit, I don't think that this is like the most shocking news story. This is not a headline to go on here. I was able to get a degree in this for a reason. It's beneficial. So we kind of all know this in this room, and yet the CDC report in 2020 put out the survey that 75.8% of Americans do not reach the recommended guidelines for physical activity. So to me, something is going on there. We know that this could be beneficial for us, yet we're not doing this. And I don't mean that from a place of shame. I want to just actually talk about what's going on and how we can make a change there. Let's get even more specific. We're talking about liver disease today. I've heard lots of stories of liver cancer. I'm going to specifically speak about non-alcoholic fatty liver disease because that's where the research that I'm most familiar with and what I work with. So just a guess from the room, a lot of people know this, how many people think that exercise could be an impactful treatment for non-alcoholic fatty? Again, every hand in the room goes up, right? It is really one of the biggest treatments that we have is diet and exercise, lifestyle changes there. It can make a huge, huge difference. You can decrease your risk of incident of non-alcoholic fatty liver disease by 50% by meeting the recommended guidelines for physical activity. That's huge. When we look at treatment and outcome, 50% is amazing. Your overall cardiovascular disease mortality after 10 years of moderate to vigorous activity decreases. So it's really impactful. We're going to talk about some ways that we can do it and what can happen there. And I hope to give you some tangible steps to make this happen today. When studied, we see a lot of benefits of physical activity. And I know you all think that it's beneficial, so we don't need to go too far into this, but just some of the ways that this can benefit you. Immediately speaking, we start to see a reduction in liver fat in the body. We also see improvements in cardiovascular health, in body compositions, that's the amount of fat versus muscle that your body has. We see an increase in your cardiorespiratory fitness, and we see an increase in your overall health-related quality of life. Now, something that I think is really interesting about all of these benefits, and it's rather new in the research, is that all of these benefits occur separately from clinically significant weight loss. So a lot of times we think that exercise is how we lose weight, it's how we change our body composition, and it is frequently a benefit of physical activity, but you can get all of these benefits on non-alcoholic fatty liver disease separately from weight loss, which is very exciting to me. I don't necessarily believe in my practice that weight loss is best treated through exercise. It's very helpful for that. There's many other things there. Our diet and our lifestyle is a big impact in that one. But when we're specifically talking about liver health, you can help that with exercise alone, which is exciting to me. Yeah, it's what we do. You also see some benefits in the gut-liver axis, some dysfunction there. There's also some newer research coming out about the effect of exercise and physical activity on gene expression for liver health, which is, again, really exciting stuff when we're talking about things that might be more about genetics. But a lot of this stuff is still in the works. It's new research. There's a lot of people in the room who are familiar with research, so it takes a long time for this stuff to come out. So we're going to talk about things that you can really kind of do in your everyday life. So the guidelines, this is what everybody wants to hear. How much do I need to do what type? General guidelines for physical activity, this is from the American College of Sports Medicine, who I'm certified through, is 150 minutes a week of moderate intensity physical activity. So if you're doing that in 30-minute bouts, we're looking at 5 days of the week, you do 30 minutes of moderate physical activity. And that's really all you need. I think sometimes we think physical activity means I've got to go to this like hour-long CrossFit class every single day, and I've got to be, a big gym person, and that's just not what it looks like here. We're talking about moving the body. If you are the sort of person who is able to handle vigorous intensity activity, and we'll talk about the difference there, you could decrease the number of minutes that you need to do, so that would be 75 minutes of activity there. Aerobic exercise right now in the research looks like the most beneficial. So we're talking about things that get your heart rate going. I know we talked about maybe not loving cardio a little bit earlier, doing runs. That's what the research, that's not good. That's what the research points to. We're going to talk about some of those specifics a little bit later though. So what's the difference between moderate and vigorous or low intensity physical activity? So cameras out, y'all. Here we go. This chart breaks down how I like to track levels of intensity and exertion with my clients. And these are all really applicable strategies that you can apply. So across the top of this chart here, I've got 3 different methods you can use. We talk about target heart rate zones, rate of perceived exertion, and the talk test. So in order to figure out your target heart rate zone, all you need to do is subtract your age from 220. That gives you essentially your maximum heart rate. Now this is a regression model, so it's not exact, but if you have some wearable technology like so many of us do, and you get a heart rate tracking here, 220 minus your age gives you your max heart rate. So if you're working at a low intensity, we're talking about 57 to 64% of that max heart rate that you calculated. Moderate intensity, where you want 150 minutes a week, we're looking at 65 to 75% of your heart rate max. High intensity, we're looking at 76 to 96% of your heart rate max. I would say if you are worried about any sort of conditions you may have, certain medications, I may recommend just avoiding high intensity activity, but you can certainly seek out an exercise physiologist or your doctor to talk about if that's appropriate for you. I'll be honest, heart rate calculations are my least favorite means of tracking exercise for most people because it's really scientific, and you're running on a treadmill. Are you looking at your watch the whole time, or it's just not my favorite. So I love to talk about rate of perceived exertion. If we're looking at a scale of 1 to 10, 1 is your max. 1 is you're laying on the couch, and 10 is you can't do this for longer than 30 seconds. Your sweet spot on moderate activity is going to be a 4 to a 6 out of 10. And you can rate that with anything you're doing. You can walk up a flight of stairs and say, on a scale of 1 to 10, how hard was that for me? And that's a pretty good gauge. We see that this is pretty much just as accurate as looking at the heart rate for general population. High intensity, vigorous activity, anywhere from 7 to 10. Again, it's not my favorite to see people do. It can have great benefits there, but when we're just looking at overall health goals, I like to see that moderate range. Talk test is one of my favorites for aerobic activity specifically. So if you were low intensity, you could stand up here and give a presentation. This is not too hard, I'm okay. If I were working at my moderate intensity rate, I'd be maybe, okay, talking to you. Hey, this is Kristen, right? But I'm breathy. I'm having to pause for a few moments. You can still talk, but you don't really want to give a presentation at that time. High intensity, we're talking about breathless. You should still be able to speak. If you can't speak at all, we're a little bit worried about what's going on, but a good gauge of that is you want to say, hi, I'm okay, and then you want to end that conversation immediately. That's how we look at breathless there. These are a great way to gauge this. So again, that 150 minutes a week, we're looking at everything in that middle row. 75 minutes a week is that bottom row. Does anyone have any questions about how to gauge your intensity levels for physical activity? Wonderful.
You exercise and sweat.
Yeah, absolutely. Sweat is not always a precise indicator of how hard you're working, though. So people frequently are like heavier sweaters, myself included. You know, I'm in like a restorative yoga class and I'm sweating, so it's not. I'm pretty fit, so it's not always a good gauge. Other people just find that they don't sweat as frequently, so that's not always like a great way. But generally speaking, the harder you're working, the sweatier you're going to be. Absolutely. All right. So another option to take a picture if you want to see some types of exercises you could do. I gave myself a 2-minute challenge to brain dump as many forms of physical activity as I could onto a slide for you. I wanted specifically not to take too long to put this slide together because your possibilities are limitless for what you could do, and it depends on what you enjoy doing the most. So when we're talking about aerobic activity, we're talking about things that get your heart rate up. Again, that talk test kind of comes in. That's what the research we have right now points to as most effective for treatment of non-alcoholic fatty liver disease. Resistance training, you can use a ton of different stuff from free weights to bands, equipment. That's anything that feels like strength training. Hybrid and other forms of activity, yoga, Pilates, recreational sports, all of those are going to be under the category of physical activity. So when guidelines mention physical activity, they're talking about some of the forms in that category. When we talk about lifestyle change and the difference between a sedentary lifestyle and an active lifestyle, we're looking really at the types of movement you do throughout your day. So do you do things like walking throughout the day? Do you do things like gardening? Do you sit at a desk for 8 hours? Those are really impactful too. And unfortunately, some of the research that I'm starting to see in my practice is that even if you meet those physical activity guidelines for 150 minutes, let's say you do take that CrossFit class for an hour every single day of the week, if you then go to work and you sit down all day and you don't move, you may be at risk for some of the metabolic conditions that we see start to come. So we want to start to move into these lifestyle changes here. I've seen lots of fun stories on impacts of walking for 5 minutes every 30 minutes. So if you do sit a lot, you can set a timer and just get up for 5 minutes every 30. I know we have a registered dietitian speaking later, so hopefully she'll talk about some of this stuff, but things like walking directly after you eat for 10 minutes, we want that low intensity activity right after eating. Those are the things that I look for to determine whether someone is sedentary or if they're living an active lifestyle. Do you have a question?
Yeah, so I'm a provider. Just a question on counseling patients.
Yeah.
How do you incorporate or turn that lifestyle? Like when somebody comes to me, they're like, well, I'm busy, I'm up on my feet all day. How does that calculator contribute into that 150 minutes of moderate intensity exercise recommended? Yeah,
absolutely. I hope the second half of my presentation gives some good answers to that, but that's really the issue. I think it comes down to a level of priorities and kind of the psychology of why we work out or don't work out or move our bodies. And if you are in a state of overwhelm and stress, then it's really hard to kind of see how, if you're just really busy all day or you're stressed out because you move so much, it's hard to imagine that you could change your lifestyle. So I actually think that working with coaches, trainers who have a psychology background or apply that kind of apply those practices can be really helpful. I think the best strategy is like use what you have and do what you can and start where you are. So it's overwhelming to think like, oh gosh, I have to hit 150 minutes a week, right? But if you're currently doing 0, next week, could you do 10 minutes? Figure out like where that fits in their life. And I think, speaking candidly, one of the issues we have is that you don't probably have a lot of time in your practice to have those like lengthy conversations with people. But I think the idea that like every little bit helps, and setting timers on your phone or just sort of like building that into your workday and your lifestyle is most helpful. Yeah, in the back.
Quick question, back to your previous slide. What is the rate of perceived exertion?
Yeah, that one is, can I go back? Let's see. Oh, we can, yay. So it correlates with the heart rate intensity. It's sort of like a method of tracking exercise intensity that was born out of heart rate training, just with a goal of making it easier for people to tell. So the rate of perceived exertion is just like, how hard does this activity feel for you? So let's say at any given, like if I had you all stand up right now and do jumping jacks, which I'm going to spare you doing that. Yeah, it's just like, how hard does that feel? 1 is nothing, 10 is like maximal. Yeah, yeah.
So that's very subjective.
Very subjective, but I believe pretty deeply, both with my nutrition coaching and my physical activity coaching, that you know what's best for you. I think everybody knows their bodies really well. We maybe live in societies that distract us from our intuitive kind of knowing, but you probably know if this is hard enough for you or not. Yeah.
I watch Channel 39, Christian TV station, 8:30 in the morning, have about 30 minutes. They exercise.
Oh, that's amazing.
Exercise by faith.
Ooh.
Yeah, Teresa is speaking about Bible and then exercise. Is that enough? It's kind of light.
Yeah.
Stretch all your body.
Sure. I think a lot of times what we perceive as too light could still be beneficial. We're going to talk in a minute about how the guidelines are a little bit vague and the research is a little bit vague. So I would say if you're doing something and your doctor says your numbers look good and everything else looks good, then it's enough for you.
Really light.
It could be. My annoying answer is that it depends. Yes, absolutely.
Well, to the doctor and to that, I think that patients, we want to get patted on the head. And so I teach exercise, I teach yoga, and I stay active. And with my doctor, I'm ready to go in and tell him how much I'm doing, him or her, I both. And just the split-second moment of praise from my doctor keeps me highly motivated, because it makes me feel like it's a more intimate exchange than ALT-AST level, you know? It's very intimate. So I would just throw that out there. Just a word of praise, and man, I'll work really hard, because I don't want to show up in your office without that good report. Yeah.
That's great feedback. Yeah, I'm like a cheerleader for all of my. I set up a lot of means of communication with my clients, where every day, if they do something, it clicks into my app, and I'm like, "Yay, go you, good job." Yeah.
So I'm just going to counter this with what I perceive as a bias in the Southeast, that just because I'm fairly thin doesn't mean I'm fit, right? It doesn't mean I'm fit, and my doctors never ask me about exercise because I'm thinner than the average patient they see in Alabama, and they just don't ask. In fact, when I ended up having had gallbladder disease and had a gallbladder taken out, my PCP said to me, "Well, you've got like 3 of the 4 risk factors." And I said, "What's that?" And he said, "Fair, 40s, I can't remember what the 3rd F is." And he said, "But you don't have the 4th F." And I said, "Well, what's that?" And he said, "Well, you're not fat." And I was like, "All right, okay."
Yikes.
And so I guess I think there is this perceived bias in the Southeast where they think you're fit if you look thin. And I'm not. I'm in the worst shape of my life right now. So I'm not fit at all. And I saw my stomach the other day. I was horrified. But, you know, I think it's kind of an interesting thing.
Yeah, absolutely. I can't necessarily speak for physicians and the medical training and how that's received and how that's done in the practice. I will say, as an exercise physiologist, the fitness community and the education around what I do has really moved away from this notion that the way any person looks actually determines their fitness. There's no part of my practice where I am measuring someone's body around and saying that's going to determine like whether you're capable of running this marathon or doing this number of squats. That's not how I test someone. It exists. I can't pretend like it doesn't, but it's certainly not how I practice. Yeah. Yeah.
The exertion in the middle, exertion means move around or what?
Yeah. So how hard is let's say you go for a walk, any kind of like movement, it's how hard that is. Yeah, absolutely. So as I was doing my review of the research from 2023, there was a roundtable with the American College of Sports Medicine. And I wanted to double check things before I came and spoke to you all today. It's been about 10 years since I got my undergrad degree. And in honesty, I just work a lot. I do a lot of squats with people. We do a lot of workouts. I don't talk too much about the minute details of what you really need. So I wanted to double check that I still had the right information and go through everything. And I found 2 quotes from the journal article about this roundtable last year that really stuck out to me. The first being that physician counseling and education are rarely alone enough to elicit lifestyle change from people, which made me disheartened because I think physicians are the people that you see most, and this is not coming down. This is not the fault of the physician. I think this is a fault of the system that we're in, where you don't have access to people who have the time and the ability to change lifestyles. And that despite decades of research, no single optimal exercise prescription has been identified for non-alcoholic fatty liver disease. And this is why I didn't want to just leave you with those guidelines on that last slide. So for example, we really don't know if aerobic exercise versus resistance training is better for you, or things like HIIT training versus moderate intensity interval training, or moderate intensity physical activity. I've yet to see a study on yoga or Pilates. It could be out there. I just haven't seen it. So we really don't know, which is why I want you to feel empowered by that rather than overwhelmed by that, where the version of exercise that is most enjoyable to you is the one you're most likely to do, and you should get out there and do that one. And don't stress over, but I don't really like cardio, but I think that's the better one for me. Do what feels good to you. Do it to the best of your ability, and check and listen to your body and listen to how that feels. So when I'm trying to help...
The exercise repetition will be decreased because of age. Sometimes like push-ups, if you're young, you do like 30, but when you're getting older, it's reduced to 13. Then you get older, maybe even less. Is that true?
Yeah, well, I would say it's not exactly tied with age, but it's tied with what your own exertion level feels like. So as you get older, it may become more difficult to do the same amount of push-ups that you did when you were 20.
Kind of warm up.
Yeah.
For the work.
Yeah, so you always want to be working in a range that feels challenging but doable for yourself. And age could be a factor with that. Gender could be a factor with that. How trained you are could be a factor with that. So you kind of always want to work in that range. When I work in my practice with my clients, I like to focus a little bit more on the lifestyle changes and building a habit and a theme of resiliency rather than focusing too much on any one specific exercise. I find that we get more changes. So I wanted to provide everyone with a little bit of a framework for what we can look at to help make lifestyle changes. So I hear 4 excuses most commonly when somebody signs up to work with me, regardless of the goal. This is like every single client. We have a perceived lack of time, which I say perceived because everybody has 24 hours in the day. We all have this amount of time. You use your time differently based on what's a priority to you, or how aware you are of what's a priority to you. We might have a lack of resources. Some of this can be changed. Some of this cannot be changed. Some are limited and some are not. I see a lot of people take on unsustainable amount of changes at once. So if you're currently not doing any activity, you're like, I'm gonna do this 30-day challenge. And then at the end of 30 days, you're like, oh, thank God I don't have to do this anymore, right? You did too much if it's not something that you can do for the rest of your life. And then the final one that I think we have the most ability to work with is feelings of stress or overwhelm. So that idea that like, life is just too much right now. I just can't. I'm overwhelmed here. So when we think about mental resilience, this is the way we kind of combat this stress and overwhelm. Resiliency is the process and the outcome of adapting to difficult situations. The three things we can play with when we want to build resiliency with someone are their view of and engagement with the world, the availability and quality of social resources, and their specific coping strategies that they have. So I have a lot of questions on these next slides. If you are interested in journaling about this or thinking it more, grab a screenshot of this, or you can head to my website. I have it all posted there as well. We're gonna go through this step by step and think how we can do this. So I want you to look at the way you view and engage with exercise. Ask yourself questions like, what's your story going on in your head when you think about do you hate cardio? I'm sorry I'm picking on you, but you were vulnerable enough to speak about your truth, yes, on the microphone. So, right, so we hear stories like, oh, I hate cardio, I'm not a runner, or I couldn't do a pull-up, right? These stories that we just pick up and you decide that this is how you feel about exercise. Take note of that because that's gonna impact how you make decisions here. What's going on while you are exercising? When your heart rate is up, do you think everybody's looking at you or watching you? They're probably not. I spent a lot of time in gyms with people working out. Everybody is very worried about themselves, but this is all helpful data when you want to make change for yourself. Thinking about how you feel when you're exercising, can you use all 5 of your senses to figure out what that feels like to you? This will help you identify which forms of exercise you enjoy doing the most and are most likely to continue doing. The next one I look at is the availability and quality of resources to you. Things like, do you have access to someone who can help you exercise? Maybe you have bad knees, and so you want to make sure that you're exercising in a way that doesn't hurt your knees. Do you have a gym membership available to you? You know, we're at a YMCA right now. They have a lot of really wonderful programs to make gyms accessible to everyone, or maybe you can watch a 30-minute TV show and get your exercise in. But it's examining what you have in your network. And time, I put on this one. How hard is it to make time in your day? I think that's probably more than I can solve in a short presentation to everyone. Last one I want to talk is the specific coping strategies that you have. This one is really about what happens to you when life gets hard. Are we just giving up on it, or do we find a way to pivot? Do we find a way to avoid that 0 to 100 mentality and find that happy medium there? Are your goals realistic? Are you taking on too much at once? Do you beat yourself up if you don't reach your goal, or do you maybe give yourself a little reward for hitting your goal? In my experience, the answers to these questions make much more of a difference in my clients than just saying like, oh, you got to get that run, you got to go for it. So this is really how I like to train my clients, and I hope that some of this can be beneficial to you, your loved ones, people around you. I'm very happy to see people taking pictures of this because this is what I work with my clients on. All right. If you didn't grab a screenshot or you want a better quality, I did put my website up here. I have a blog post with all of these questions and a little bit more. And this is what it's like to be my client. So I hope you guys enjoyed all of that.